while this bill may not include cuts to Medicaid, as Mr. Pallone, Ranking Member Pallone has pointed out, the math doesn't work for this committee to reach the $880 billion that it has been told to cut without cuts to Medicaid. The Congressional Budget Office has confirmed that. And we've seen Republican proposals floated that would impose per capita caps, eliminate the 90% federal matching rate for Medicaid expansion, and implement burdensome work reporting requirements. And I want to focus a bit on what happens if we eliminate the 90% federal matching rate and how it relates to addressing mental health and substance use disorders. Medicaid is the largest payer for behavioral health services, including treatment for substance use disorders, and covers nearly 40% of Americans living with an opioid use disorder. Now, in Virginia, there were over 133,000 Medicaid beneficiaries with an identified substance use disorder. Virginia is one of 9 states that have trigger laws that state all of the individuals covered under expansion would immediately lose access to their health care and therefore substance use treatment if cuts to Medicaid include cuts to that 90% match. In rural areas, community health centers play a critical role in treating substance use disorders, and cuts to Medicaid could close rural hospitals. When we expanded Medicaid in Virginia, a big reason why Republicans in rural areas supported it was because it would keep their hospitals open. And we have seen estimates that every hospital west of Charlottesville, Virginia, could close if we unwind Medicaid expansion. Our community health centers serve patients at over 200 service sites in Virginia, 44% in rural areas that would be at risk if Medicaid is unwound. And so I think it's important to look at this bill in the larger context of what is happening in this Congress, what is happening with this administration. And the goal here, I think we all agree, is we want more Americans to be healthy. And Medicaid patients actually are healthier than private pay patients in many cases because they are connected to medical homes for the first time sometimes in their life. And when they show up for medical visits, they're often less expensive than private pay providers. So let's look at the big picture and look at what, as we pass a bill to address the opioid and substance use disorder, let's look at what would happen and how useless this bill will be if there are Medicaid cuts that come out of this committee as early as next week that unwinds the very services being used to provide opioid or substance use disorder treatment to 40% of Americans. Thank you, and I yield back.